Storytime, Evoluzione Radio.
Welcome everyone by Marco Ferraro, and I am ready to start talking with Emilie Rigaud, but it's just a matter of pronunciation that I want to teach step by step by our conversation. Emilie is here, is ready to talk about CRPS. What is this kind of name? What is this society we want to discover together? But first of all, I want you to be ready to take a look, to visit our websites. But now it's time to talk with Emilie. Emilie, welcome here. Ciao.
Ciao.
Okay.
Hi.
So just a little introduction of yourself. Well,
Okay, so I'm Emilie. I'm a patient care coordinator for Medical Tourism Italy, and our main division being CRPS, which is what we're going to talk about today.
Sure. But what does it mean? What is CRPS?
So CRPS is complex regional pain syndrome. It's a pain condition, a chronic pain condition that is a very, very painful condition that is pretty rare. So it's not really known nor talked about, especially in the countries that have a lot of cases like America. It's divided in two different types so far. So we have CRPS type 1, which is the most common one, and then CRPS type 2, which is the one that affects a nerve in the initial injury of the condition.
Okay. Can you tell me something more deep about pain conditions?
So pain condition, chronic pain, chronic is defined by a condition that lasts or occurs or comes back on a period of 3 months or more. So any pain condition that lasts 3 months or more is defined as chronic. So as CRPS, fibromyalgia, or even arthritis.
Okay. Can you describe the effect, the pain, the specific pain of CRPS?
So CRPS, actually, there is a pain scale that is called the McGill pain scale, and CRPS has been put on the complete top of it, which means it's set higher than actual birth, like childbirth,
Sure.
or even amputation. So it's the highest level of pain known really right now, and it's burning, sharp, very intense pain, and these people live with it 24/7. So it's a very
Never ending.
It's never ending. It's never ending. It can be helped. It can be. Some people have even reached remission, of course, with certain kind of treatment, but it's a rare condition. So it's very hard to have specialists who know about the condition and the treatments.
Okay. What are the symptoms that the person can recognize about the CRPS?
So of course we've talked about the pain, which is a very specific pain. So it's a burning kind of sensation. And then we have swelling of the affected area. We have change of color, so it turns to red or purple. Change of temperature of the affected area. We have, muscle loss, we have muscle pain, and the sensation of pins and needles, is what they call, and just this burning sensation that people feel. There's a wide range of symptoms, but these are the most common ones.
Okay, Emilie, some specific areas of the muscles, or?
So no, it's affecting a specific area. It happens after an injury or maybe a surgery. Most of the people that we've seen, it's maybe a surgery or a sprained ankle or a broken bone, a fracture or something. So something happens after an injury, and the actual process of it's kind of difficult to explain or understand it, but there's a pain that is felt that is not normal after the
unusual
surgery. It's unusual, so it shouldn't be there, and the level of pain shouldn't be there after the surgery or after the actual injury itself.
Okay.
And like I was saying before, if there's a nerve damage on top of that, then it's the type 2 CRPS. Otherwise, the most common one is the type 1 CRPS.
What's the source of it? I mean, how can the CRPS can happen?
That's also another point that is very difficult to answer. Even scientists are pretty confused on how exactly it's happening, what exactly is behind the arrival of the actual disease itself. We just know that it's a very inflammatory reaction. So a lot of the work that has to be done is anti-inflammatory on the affected area and on the body itself.
Sure, for sure. What are the treatments for it? For sure.
So the problem with rare diseases is that a lot of them don't have treatments or cure. Right now in America, which is where 90% of our patients come from, they have different kind of treatments. They have the ketamine infusions, they have nerve blocks, they have spinal cord stimulators, and another wide range of, kind of treatment that unfortunately are working on kind of hiding the pain or helping with the pain, but for a short amount of time, which means they have to be repeated. Or it's very invasive, like the spinal cord surgery. It's a very invasive thing. These treatments are not used here because here in Italy we have the NERIDRONATE treatment, which is was discovered and patented here by an Italian doctor, which is why right now it's the only country that has this treatment. And of course it's not invasive whatsoever.
Okay, I'm curious about what are the first dialogue you start doing with the people facing the CRPS?
So usually we have people, unfortunately being the other side of the ocean, we have people who have been fighting the disease for quite a long period of time already because they hear about the treatment in Italy so far along the line. So they get in touch with us and they just kind of ask us information on the treatment and how to get started. And then, our goal is kind of understanding exactly their specific case and try to create something around the NERIDRONATE, but really for every single patient.
Okay. Emilie, what does NERIDRONATE mean?
So NERIDRONATE is it's a drug, it's a bisphosphonate drug, which is the one that I was telling you before. That was discovered and patented here in Italy, and for now it's the only actual drug treatment that is recognized by a government for the treatment of CRPS. And it's been about 8 years now that it's on the market, let's say. And it's been about 8 years that we do have international patients here to welcome them, to kind of help them going through this, because we are the only place in the world right now having this treatment for CRPS.
Okay, what are the 360 treatment plans for the future?
So the 360 treatment plan is something that we've created with a lot of the specialists I work with, a lot of the medical teams I work with. It's based on the NERIDRONATE infusions, but it's really working on precision medicine, so making sure that we create a treatment plan that is adapted to every single patient, just so that we give them the most chances possible to have a good chance of remission or recovery. It's a very long subject though, so we probably gonna need another full podcast for this.
For sure.
But yeah, it's very important to focus on every single patient to create something adapted to them. Of course, the base is the NERIDRONATE infusions, but around it, there's a lot that can be done to help even further.
Okay. At the moment, I just want to thank you for your time here. So see you next time.
Thank you. Thank you very
Emilie.
much.
Okay. Bye-bye for you as well. Ciao, ciao.
Storytime. Evoluzione Radio.